All attendees are in listen-only mode.
Good afternoon, everyone, and thank you for joining us for another Learning Lunch hosted by FormatApproved.com. My name is Wendy Whitmore. I'm the CIO of Format Approved, and I will be your moderator today, sitting in for the ever-talented Brian Johnson. Today's Learning Lunch is entitled HIPAA New Year, Adding Cyber Data Breach Insurance to a 2014 Preparedness Plan. And all I can say about that, Christine, is that that is quite a mouthful. We're joined today by Christine Marciano. She is president of Cyber Data Risk Managers, an independent insurance agency based in Princeton, New Jersey, that specializes in data privacy, cyber liability risk, D&O insurance, and IP protection. Christine is a licensed insurance agent and a specialist in cyber and data security. We're pleased to share her expertise with you today. Remember that you can ask questions of our presenter at any time during today's session by entering them into the chat area. In the second half of our session, we will address as many questions as time allows. If we do run out of time, answers to all submitted questions will be posted to our website and sent via email link later in the week. Also, please note that all registered attendees of today's session will receive an email with links to both the slides and the recorded versions of this event. This is a common question that we are asked throughout the presentation, so be aware that you will receive an email following this session with links to the slide deck and the recorded version of this event. So thanks very much, Christine, for joining us. I really appreciate having you in our Learning Lunch group, and we look forward to addressing this mouthful of a topic.
Thank you, Wendy. I'm happy to be here.
So let's start by talking about, now this is a big slide, let's start by talking about the volume of data breaches that are happening and have been happening recently.
Sure. Well, I don't want to really focus on the names here. The importance of this slide is just showing how the different data breaches are happening in the healthcare industry. The first one, as you see, a hacker broke into a server. So, healthcare information is being attacked by outside external forces such as hackers. And then the other breaches we see here, some of them involved unencrypted laptops. Maybe it was just a laptop that was stolen from an office. And then there was some unauthorized access by employees, which this one particularly expanded over a 4-year period that the organization wasn't aware that the employee was accessing the information. And then some malware infested patient records, and then a contractor from the outside taking information onto their personal email address. So just a bunch of different ways as breaches continue to happen, and the breaches vary, of course, in nature, but we seem to see a lot of unencrypted laptops still out there, which are, a big cause of data breaches today.
Yeah, and it's amazing to me because that is literally one of the simplest things that you can do to solve the problem. Is making sure that you've got, talk to your IT specialist and say, hey, are my laptops encrypted? Because it is a very, very it's a very easy solution to a lot of potential breach activity. That and also the common use of flash drives. That's another sort of brilliant way in which breaches are happening very, very, very easily, is that those flash drives with patient records on them that are moving patient records from one computer to another computer or back and forth from home to the office, those flash drives go missing and you've got a breach.
Yeah, it's so true. And today, healthcare organizations have definitely stepped up their encryption measures, but it always seems, that one that you forgot, you thought was encrypted, it's the one that's stolen, and then next thing you know, you've got to have data breach you have to deal with. So these things happen, and, luckily there are different procedures and methods such as encrypting the information, but unfortunately, it just seems to be that one that's, sitting there in the office, you thought was encrypted, and, next thing you know, it's gone.
Absolutely. Very common these days.
Mm-hmm.
So for the group that has decided to attend this topic today, obviously they are aware that there's an issue surrounding the potential for breach. How do they know? How do they know which things are causing that breach or that constitute a breach?
Sure. Today there are 4 different factors that need to be considered in determining whether or not it is a data breach. And for one, what is the nature of the information involved if there is a data breach? Was it sensitive, protected health information that was exposed? Was it perhaps information that might not have been identifiable? If it was clinical information, but if there's a chance that it could be re-identified, these are things that would need to be considered. And number two, who was the unauthorized person responsible for the data breach? Was it someone that had the responsibility to actually protect the privacy and security of that information? That would need to be considered, because these are just all things that you're taking into consideration to determine if it's a data breach that is a true data breach and if it needs to be reported. And number three, was the information actually accessed? And typically today, a forensics investigator would conduct an analysis to determine if it was, say, for instance, a laptop and the information was, they need to determine whether or not it was accessed or viewed. And so that's taken into consideration too to determine whether or not it's a true data breach. And then the last one, what has the covered entity or the business associate done to handle the risk? And this is considering at the time they realized that there could be a potential of exposure of data that might need to be reported. They really need to determine, what steps they need to do at that process to try to mitigate the potentiality of that information actually, causing harm. And need to determine also if there's a low probability of a data breach and that information actually being accessed and increasing the chances of identity theft, well then that's probably a breach that's going to need to be reported, because it could actually turn into identity theft down the road for that particular individual.
Absolutely, and again, the more that the practices can prepare in advance of these sorts of things happening, the better, clearly. But, it is important to protect yourself, I think, both on the front end and the back end of a potential breach. Because no matter what you do to prepare, there's always some possibility that somebody in your environment is not going to realize the gravity of a decision they make, and there's a possibility that they could share information without intending to, without meaning to.
Of course, just accidentally. Very true, and that's one of the other big factors of a data breach, how things are happening today.
Absolutely. And on that note, can data breach be prevented? Prevented. That's a good question, and it's a good question because actually, people assume that what I just said is true across the board, that no matter how much you prepare, there's a good chance that something will happen. I think if your employees are carefully trained, if your business associates are knowledgeable, and if you are, prepared in such a way that you've, have a high level of understanding of what your protection requirements are, I think you can certainly prevent to a high level the possibility of breach. But what are your thoughts on that, Christine?
Yeah, I think that's what you said is true. Employee negligence, it could almost entirely be, prevented just through, data breach being prevented through, having policies and procedures in place, making sure that you're training your employees, you're conducting background checks at the time of hire, and especially at the time of hire, putting them through, a privacy and security awareness training program, and then conducting that, on a periodic basis with your existing employees, just so that they're, understanding the policies and procedures, because everyone's busy doing their job today, and, privacy and security, needs to be in the forefront, but, as you're doing your job, you're not thinking of all these things that could, intentionally happen. So, employee training is so key because it could help, prevent a data breach from happening. And then, as we mentioned earlier, encrypting your devices, and especially encrypting those mobile devices healthcare organizations are using, there on the organizations, if it's an iPad or an iPhone, any kind of mobile device, even a USB, drive. You want to make sure that that's encrypted, because those are the things that, we're seeing out there that is, getting stolen. And if it's, not encrypted, then unfortunately that's a data breach. And then the last one, hackers and thieves, unfortunately you can't stop them from getting in. No matter how good your security is, the attacks just seem to be getting more sophisticated by the day. So I think that's, you try to invest as much as you can in security, but there's always that slight chance, unfortunately, that someone's going to be able to get in.
Yeah, so a good example, I mean, although it's not in healthcare, but the recent Target breach, you know, a good a good portion of that hacking that went on in that system and some other systems that were attacked by that particular piece of software were easily accessed because the IT company neglected to put in a change to the generic administrative password. So silly things like that. I mean, simple oversight on the part of on the part of a technology professional or your business associates can cause that. That's why you also want to make sure that, you know, another level of prevention that I generally recommend as a consultant is to make sure that, you know, as you are engaging business associates in the process of protecting yourself, that you make sure that they are knowledgeable about HIPAA, not just your employees, but the people that you're hiring to help you set this stuff up. That's an important component as well.
Yes, it's very important. You want to definitely take a look at, you know, the business associate agreement and make sure that they're, you know, following and matching the policies and procedures of your organization, if not, you know, protecting it a step better.
Absolutely. So, Christine, you know, what can these clients do? What can these organizations do to prepare for a breach, or to, you know, to in advance to make sure that they are remaining proactive?
Sure. Well, one step, of course, would be creating an incident response plan, sort of, you know, taking a proactive stance to a data breach. We all know that a question of, you know, it's no longer a matter of if a data breach is going to happen. It's just, unfortunately, it's a question of when. And when it does happen, you know, as you see out there with Target, you want to make sure that you're doing everything, you know, in the right manner. So the eventuality of having it come back to haunt you in the end, you know, is minimized, and the potential of your reputation taking any harm can also be minimized, you know, through the creation of an incident response plan before your event even happens. And then number two, which I focus and specialize in, is the cyber data breach insurance policy, of how you can take that and use it as a component to your data breach incident response plan. So it sort of, you know, works in conjunction with your plan that you've put in place, and it offers, you know, the services that come into play that we'll talk about in a little while, that could be used, you know, when a data breach happens and responding to it.
Yeah, this is an interesting, is this a new area, Christine? I'm just fascinated by this. You know, obviously data breach in and of itself as a topic out in the ethos is relatively new. I mean, although HIPAA has been around for a very long time, the idea that, you know, these data breaches are being publicized and folks are becoming more aware, and there are more auditors involved and that sort of thing. Is this type of insurance relatively new as well?
It is fairly new. Cyber insurance has been around for at least 10 years, but this particular product has really only evolved within the last, you know, few years, just with all the things that are happening. And as you know, healthcare organizations know, HIPAA always just seemed to be sort of like a compliance checklist. You check it and you thought you were compliant and you were done with it and you didn't think about it. So with this type of insurance, it's kind of evolved in the same, you know, way, where it's really just starting to, you know, be on healthcare organizations' mind, just knowing that, you know, it's there so that when events happen, it's just a way that they can make one phone call and it responds to the event. So it's something that's, you know, it's evolved with HIPAA. It's evolved with the various privacy state laws that are out there today. So it seems to be evolving, you know, with the course of data breaches and how things just are continually happening today.
Well, I like the idea of involving it in your incident response plan. I think that's kind of an interesting approach to take. But yeah, you know, people think about, actually curiously, I think the medical community in general has been, as you mentioned, accustomed to checking the box and just assuming all is well. And things have changed a lot, certainly since the omnibus update, but also in general, I think the idea that you can show a PowerPoint to your staff and on what, you know, how they're supposed to keep an eye on patient health information and assume that you're done is no longer true. And I think that's a part that people have to be made aware of at this point. But of course, having all kinds of steps involved in following up from an incident standpoint is a really good idea as well. So speaking of which, with an incident response plan, what if obviously you have some recommendations here. What kind of structure should that have?
Sure. Well, when you're setting up your incident response plan, you want to create a team of players so that when your response team when your data breach happens, you have a team already in place to be able to act and know who is going to report the data breach, who's going to mail out the letters and such, and you want to determine who's going to be there 24/7, who's going to be the first one to respond. These are all things you need to take into consideration when you're creating your incident response plan, as well as developing any vendor and law enforcement relationships ahead of time so that you're not running around trying to figure out who do you have to call. This will already be documented in your incident response plan before your event happens. And a notification tree, really, you want to implement that into your plan. It's just really a tiered level of the contacts that you need to reach out to number one, report the breach, and then all of the other players who come involved into the response piece, as well as creating your communication template and the scripts so that you already know, how the data breach outline created. Of course, you don't know how the data breach is going to happen, but when it does happen, you already have your letter prepared so that you can just kind of fill in the blanks of how did it happen, what are you doing to mitigate it, and then have a script already prepared as well to just have a template ready and fill in the blanks so that you're not running around and putting these pieces together at the time of your breach. Because again, the focus is all on you, how you're responding to the breach. So that's why we want the incident response plan in place before things happen. And then just knowing who can you call upon, resources, and who could be there, at the time of the breach. These are all things you need to incorporate into your breach. Of course, employee training, that's a big key in preventing these breaches from happening in the first place. And then also regulatory and legal review, you want to make sure that you know who do you have to report the breach to, and of course we all know that in healthcare it's HHS and who else. I know I just read something before earlier this morning that there's some kind of new ruling with the FTC that the FTC might be able to also, besides HIPAA being enforced for compliance, but the FTC might be able to enforce covered entities. And unfortunately, that means that when a breach happens, not only are healthcare organizations facing a potential HIPAA fine, but now at the same time they might be also facing an FTC penalty and fine and investigation. So you need to know ahead of time and incorporate these things into your response plan, and then making sure you're reviewing it periodically, and at the same time considering the purchase of cyber and data breach insurance, of how it could help complement your incident response plan.
And that breach insurance, obviously we're going to discuss that a little bit more here, but that breach insurance comes into play in what situations? I assume we're addressing that as we move through the slides, but if you're talking about an incident response plan and you have an incident, I assume it's at the point of a fine being assessed, or?
Oh, sure. In respects to the insurance, this is something that you want to proactively purchase before your event happens. So it's just something it's just a piece of your incident response plan, because for taking a proactive stance, before a breach happens, and having the plan in place, and also incorporating, the purchase of cyber and data breach insurance, ahead of such events into the plan. It just sort of creates and complements the plan before the events happen. So it's a proactive measure to take, in consideration before events happen.
Absolutely. It's always best for insurance purposes in general, I would say. So how, obviously you're saying you want to purchase this in advance with the expectation that something could happen, which is what insurance is all about. How are you incorporating that into the response plan itself?
Sure. Well, in the early slide I mentioned, putting together a response team. With this type of insurance, the response team is already in place at the time you call. We already have selected preferred providers in place, such as data breach resolutions providers. Those are the ones that will help mail out the letters, put the call center together. We have attorneys, forensic investigators. So it's one call, to tell the myself, the insurance agent, or the insurance company that there has been an event. And so the incident response team kind of jumps into place and starts responding and managing the aftermath of the particular incident. And then as well as, it's trying to minimize the reputation damage that could happen, when a breach gets out there in the public, as well as being able to help mitigate any penalties and fines that might be assessed, down the road from HIPAA. And with all the various state laws, there's 46 going on 47 state privacy laws that need to be taken into consideration with patients being, living in different states. That needs to, letters need to be sent out to all the data breach victims, but at the same time recognizing 46 different state laws. So we kind of help take the stress off of the healthcare organization from having to do that. That's just something that the insurance is taking, over for the organization. And then, of course, helping to minimize the uncertainty of managing a comprehensive infected response versus, the fire alarm goes off and then not knowing who you're going to call or as such. So it's really meant to be, complementary to, your existing incident response plan, or if you haven't had a chance to even set up an incident response plan, it could kind of, take the place of that because it's just a phone call and we already have everything in place in addition to what the facility might have already done.
So that's interesting. So this insurance plan doesn't only provide financial support, it also directs the participant toward solution steps?
Yes, it does. It's it's like sort of, if you look at it, you could almost sort of see it as a service provider contract. You're purchasing, a contract that has all these services already on retainer of all the different vendors and providers that need to be accessed when a breach happens and needs to be responded to.
That's great. I didn't realize that. That's a really big benefit of that offering. Okay, and so obviously this is a unique type of insurance based on that last slide. Tell me, obviously, are there different versions of this, different kinds of coverage similar to like an auto insurance or a health insurance?
Sure. Well, today these policies vary greatly. There's probably about 40 to 50 insurance carriers who are writing these standalone policies, so they do vary greatly. But the services here, on this on the screen, are primarily the sort of framework that are being offered in the coverages. Of course, they're not offered at all, and when you're actually looking to purchase one of these, you really need to sit down and understand what's in the policy because they really are scattered and not every policy offers them. But the commonly offered are notification letters. When a breach happens, you need to send out a letter if it is a true breach. That's covered within the insurance. The next step in the offering to the affected individual is credit and identity theft monitoring, another offered coverage. If there's a lawsuit down the road, and typically, we're seeing, as you saw in Target, we saw lawsuits come out the day of, when Target reported their breach. So it's not a question of if a lawsuit happens, it's a matter of when it happens. There's going to be claims defense coverage there and even coverage there within sublimits for HIPAA fines and even potential FTC fines now that they're looking to come after covered entities, unfortunately. And as well as the computer forensics investigation that needs to be in place. And this is sort of a unique coverage for healthcare organizations because in order to determine if it's a true breach, they really need to work with a forensics investigator today to determine the eventuality of that stolen laptop. Was the information actually accessed? Was it viewed? So you need to have a forensics investigator on your team. So if you picked up and called the insurance company, well, you might be able to just access that forensics investigator to determine and to help you determine whether or not this is a breach that needs to be reported. So that's an offer coverage, as well as a data breach coach, which is just another phrase for a data privacy attorney, who's going to help navigate those 46 different state laws that come into play when a breach happens. There could be some pre-incident planning services and resources. These are sort of just communication templates and scripts and risk tips that are available online when you purchase the policy. Business interruption, if you're accessing the cloud, or if it's a computer hacker, who is able to get into your network, and next thing you know, your network is offline, you could actually have coverage for that. built into the policy, as well as any social media, any digital content that is exposed and that's covered under multimedia. That's another corporate coverage. And this is an important one, data loss and reconstruction with patient health records. If someone was able to get into the network and had some fun with the records and damaged everything, there could be some coverage there. You would want to make sure that the policy you're considering actually covers that, but there could be some coverage there for data loss and reconstruction. Website defacement, there could be some coverage for that, and that typically is coverage for when a hacker is able to hack into a website and destroys the website and defaces it and leaves their logo and walks away. So you would want to reconstruct the website. There could be some coverage for that. Again, these are all coverages that vary, so when you're considering it, you need to make sure that if this is something that you need and you like, and you need to make sure that it's covered in the policy. And then cyber extortion is becoming a little bit, there's more interest revolving around that, just and that is a piece where it's sort of like kidnap ransom coverage, where someone takes and holds on to your patient health records and might put a layer of encryption on it where you can't access those data records. And the hacker might say, well, we're not going to release that information until you give us $1 million. So that's sort of could be viewed as kidnapping your information and holding it for ransom, if that's what cyber extortion is. So we're seeing a lot of that happen out there. Just there's a particular malware called Crypto Locker, and that's really what they're doing. They're holding people's hard drives and other data, for a particular amount, and that's how this coverage would work. So again, these are all coverages that are within the policy, but they do greatly vary. But these are the typically offered ones that we're offering within the policies that we sell.
Wow. That's all I can
lot,
say
right?
is cyber extortion, good Lord. My thought process, even as I was kind of reviewing some of the recent breach reports, is that I'm fascinated that people spend their time looking for ways to damage other people's businesses at this level. It's very disturbing.
Yeah, there are nation states, in other countries where this is where, they just do this all day long. It's like a whole business, run organization. You would be amazed at what's out there today.
Oh, that's terrible. Just terrible. Particularly when you're talking about, it's one thing if you're talking about, and this is not to say it's right, but, it's one thing when you're talking about payment cards linked to a big box store. It's another thing when you're talking about people and their patient health records and doctors, and boy, you got to have very low conscience to go after a person's medical records and the people related to that. Clearly these people are not thinking about that in any way, but it does seem particularly disturbing that it's related to health information. Anyway, how about individual claims? So can you give us an example of a specific claim or a group of claims and how those would be covered?
Oh, sure. Well, this is one example. Any civil regulatory action that might be brought against a healthcare organization by a regulator, meaning HIPAA, and even potentially now the FTC, in connection with there might be a potential legal violation of a privacy law or the HIPAA law that the healthcare organization, and especially if it's a public-facing privacy policy that an organization already has in place and it's there on their website. If they've done something to unintentionally violate that privacy policy, that would be a covered claim, as well as negligence, the breach of duty to protect that patient-sensitive protected health information. If your employees were negligent to do that, that's a covered claim, as well as breach of contract. And what we're talking about there is the unintentional breach of contract. Again, what I mentioned before is the public-facing privacy policy with regard to the personal identifiable information, protected health information, for failure to protect the security or the confidentiality of that, including payment card data. So there's a bunch of different things, but really with this claim that we're talking about is for regulatory action, and I think that's on the mind of, a lot of healthcare organizations that are concerned that, okay, well, a breach has happened, we've done everything to, make sure that we've mitigated the breach, but then there's always that, fear in the back of your mind that, HHS is going to come around, and even though you did what you did right and protecting, the information after the breach occurred, they still might assess you with a fine. So that's something that could be covered here in the insurance policy, and these are just the three factors that come into play, determining whether or not that's a covered claim.
And that, would you say that that's one of the more common examples?
Today, it's, with the HHS seems to have taken a little bit of a break, which is a good thing for healthcare organizations. But I believe, we're hoping that they're not going to be so proactive, as well as I'm sure the callers that are listening. But HHS has been, putting some messages out there that could be a little bit more proactive in compliance audits. So then that's when we'll see these coverages really come into view more, when healthcare organizations are really concerned that they're going to be hit with that, HIPAA fine. That's just something that's, offered within the policy. So it's not something that, has been such a, a triggered coverage claim because, HHS, again, has taken somewhat of a break. But I think in the future, if they start to take a more proactive stance in their compliance audits, it could definitely be something that healthcare organizations would appreciate having within their insurance coverage.
Got it. And are there some situations where coverage would be excluded in these policies?
One particular exclusion here would be the collection of data without patient knowledge. So if you're actually collecting any personal health information by your organization, and health organizations know they've got to abide by the HIPAA privacy policy, so they're not doing that to start with. But if they are, unfortunately, that's not going to be a covered claim. Just because you're taking the information and you're not telling your patients about it, and you might be doing things with it in ways that your patient would appreciate it, and so that's just a type of coverage that would type of claim that would be excluded because it's not something that insurance companies would appreciate either. If you're, obtaining it, in illegal ways, and it would be also, of course, a violation of law. So that's just typically an exclusion if you're collecting your patient, information without telling them and without telling them what you're doing with it.
Right. Well, that makes sense, obviously. And on average, what's your guesstimate on the kinds of costs related to this kind of insurance?
The costs really vary, but the way that premiums are factored are based upon the class of business, and we're talking about healthcare today. So that's automatically off the bat for insurance companies. It's a high risk class, so it would be deemed a high risk factor, meaning it's just going to be assessed with a higher premium, unfortunately. It's based upon the number of records held within the organization and how much they're earning on an annual basis. So these are all factors that are taken into consideration when we're looking to determine how much you're going to be paying for the coverage. And also it's also dependent upon what are you doing currently to protect your patient information, what are you doing as far as your policies and procedures. So there's just a bunch of different things, but typically what you're looking at right now is the factors as well as network security and privacy. That these are things that are being looked at to determine how much we're going to charge.
And is this like health insurance where it's applicable to individual practitioners and independent practitioners as well as clinics and larger facilities?
Right. It's something that all types and sizes can buy. Yes, if that's what you're asking.
Interesting. So we do have a few questions. Thank you for that, Christine. I mean, this is interesting to me because obviously at ForMed we have a pretty large medical community audience as well as a consultant channel, and so dealing in this particular industry, we get a lot of questions about ways to prepare, particularly since we provide HIPAA training and services. We get a lot of questions about ways to prepare and mitigate those risks. So this is an interesting contribution to that answer. I appreciate having this information. We do have a few additional questions. one question was, you earlier mentioned, or just a moment ago, mentioned that that preparedness level affects the cost of the insurance. So policies and procedures and things like that, what those folks have in place. How are the insurance companies evaluating that? And B, what would you say? Is it similar to like having a theft protection on your car? I mean, what's the adjustment?
Yeah, it's sort of like if imagine yourself applying for health insurance or especially life insurance. There's maybe a bunch of information, a bunch of questions asked as far as your past, your medical history, and same thing with this particular insurance. We're going to be asking, what are your current hygiene habits? What are you doing to protect your network? What have you done as far as your privacy training for your employees? Do you actually have a privacy officer, on staff? So we're going to be looking at, through an application process, we're going to be asking a bunch of information or questions to determine, what are you currently doing today to protect your protected health information, because that's going to be factored in to how much, you're going to end up in the end paying for the insurance. Of course, the more you're doing to protect the information, it's just going to be more favorable, and the premium will start, being reduced just from everything that you're doing to protect that data. So hopefully that answers the question.
Thank you. Yes, I think that's very helpful. Also, another question here. Do you happen to know if there's any kind of template available through the insurance groups, or for an incident response plan, or is that something that typically is done custom by each practice?
Yeah, typically it's done by the practice. There might, as far as there could be a template for communication scripts and things of that nature. But we do have like a roadmap template, so we would be able to work with the organization just through our pre-incident service providers that could be accessed either through a discounted basis or through what's known as a risk portal. If you happen to buy an insurance policy that has access to a particular risk hub, there could be some services there for incident response where we can kind of help create the roadmap. And one of the unique features of there's a bunch of different insurance policies out there, but there are several where you would have access a 1-hour complimentary consultation with an attorney who could help at least guide you in that direction of creating that incident response plan, and then you would also have access to discounted providers that could help. But there could be some templates, but they're not going to be as comprehensive as what the hospital could put together, probably on their own.
Got it. And one additional question: if the practice or the site has already done a full risk analysis and remediated any gaps and gone through the steps of training and basically have fulfilled what they feel is their mitigation plan, do you feel like this is still applicable to them? Are you still seeing, I feel like you answered this in an earlier slide by saying that there's always some risk, and obviously they're going to get some kind of discount for being prepared, it sounds like, but do you still see possibility for breach in that scenario?
I think that today you never know what's going to happen. You can walk across the street and you might not make it across. And same thing with a data breach. You think that you might have everything protected, but as you see in the news reports, there's always that unencrypted laptop that gets out there, and you think that you have everything encrypted, but there's always that chance. It might not be a huge risk, but it's always good to make sure that when an event happens that if you have insurance there to help, especially since this is a risk that's not going away. It's definitely something that while you think that you have everything all your ducks in a row, it's just something to at least explore. The risk isn't going away, and it's typically not covered in traditional insurance policies, so might be a current gap. So if you are a victim of a breach and you realize, well, I should have bought this insurance to have all the coverages, because if you look at one of the earlier slides, all those coverages, imagine if you actually had to hire an attorney, you had to send out the letters, you had to hire a forensics investigator, if there was a lawsuit and a settlement. It's going to be an expensive breach, and it's always best if you can mitigate it and pay an annual fee to have access to all those providers that we already have in place on the incident response team. I think it's something that to explore versus thinking which I'm sure that particular question is coming from. They probably have everything in place, but again, you just never know. You never know. Something could happen. Just Target's a great example.
Right, and you know, curiously, I think that's a question people ask relating to all insurance, right? If nothing happens, you know, here's an interesting question that just popped up, which is we do get a lot of consultants on these calls, in addition to the medical providers themselves, and I'm guessing this is a consultant. This person was talking to a doctor's office, and the doctor's office expressed that they thought they were too small to worry about HIPAA. What would be your communication for a practice that thinks they're too small?
No organization's too small for HIPAA. HHS is, you know, regardless of the size, especially with business associates being right there at the front line with covered entities. You know, it doesn't matter how small you are. If you've had a lapse of, and you know, data breach happen, HHS doesn't care the size or how much money you're earning. They're still going to come in and conduct their audit. So it's always a good, you know, thing to not, you know, you want to make sure that you're understanding HIPAA and not think that it can happen to you just because you're too small. Anything can happen.
Right, and I will add to that by saying that recent breach by the practice, the dermatology practice, that was not a very big practice, first of all, and it was a pretty big fine. I think it was $150,000. It was a lot of money, and you know, and it was all from a lost flash drive. So, you know, those are small practices, and you know, if you're a consultant and you're looking to make sure that your clients are being mindful regarding HIPAA, you want to keep an eye on the industry and sort of what things are happening as it relates to those breaches and the fines, etc. First of all, and second.
And in fact, I'd like to just step in and also add to the point there is also the insurance for a small organization like that. You know, data breach could actually put them out of business. Having insurance coverage, you know, kind of helps them, you know, just continue focusing on their practice after a breach happens, so that they're not forced out of business due to the high expenses that could happen, you know, when a data breach comes. So it's a way of keeping them in business. A couple of years ago, there was a health records provider that had a data breach, and the amount of the breach was more than they had in their bank account. So they actually had to file for bankruptcy, and they're no longer in business today. So I think it's the small organizations that probably, you know, would benefit more so from this particular insurance, in, you know, in the long end, as well as, you know, of course, the major providers look at it as a way of just buying insurance, and it's, you know, reducing their costs if a breach happens. So really, it's no matter what size you are, this is insurance that you really need to explore, just because it can help you stay in business or reduce, you know, your costs at the time of breach.
Yeah, and that's a good point. So if you are a small practice, that's a good point to make. If you are a small practice, your risk is actually higher from a financial standpoint, meaning, you know, if you do get slapped with a fine, there's a good chance that it's going to be devastating from a financial standpoint, whereas the larger institutions are going to have more cushion, more financial protection. And then on top of that, my answer to the question, are you so small that you don't need to worry about HIPAA, would be you're only small enough if you don't have any patients. Because honestly, it's that patient data, even if you have one patient, if that patient's data becomes available to somebody outside of the practice that is unauthorized to see that patient data, that constitutes a breach, and that's unfortunately the truth of the matter. And you want to make sure that whether you have one patient or 100 patients or 10,000 patients, that patient information is protected.
So true.
So. So that looks to be the bulk of the questions that I think are relevant to this particular conversation today. So far, if any of you have any additional questions, feel free to pop them into the box before we close out this session. And regardless, we will address them in the follow-up if we do not get to them in the moment. So thank you, Christine, for joining us for today's Learning Lunch. We very much appreciate your expertise here. To learn more about Christine and cyber data risk managers, you can visit their website and I think I got to scroll here so I can see that. And that is www.databreachinsurancequote.com. Good name, nice, easy to type name. And so that you know, I'd like to thank all of our attendees. Remember that all the registered attendees will receive an email with links to both the recorded and PDF versions of this session. Most of you have been on one of our sessions or another before, so you will know that we offer, Format Approved offers robust online education regarding HIPAA, rules and regulations for compliance officers, as well as for the workforce level training for practices, which obviously to attend HIPAA webinars you recognize is a requirement and is most easily done in an online format, as we are able to provide. If you are looking for those important documentation templates or meaningful use risk analysis, you can go to formatapproved.com and click on consulting. As for the training, if you go to our website and click on training, curriculum, you will find all of our courses listed there, including all of the compliance courses. So visit us to learn more about our upcoming Learning Lunch series. The Learning Lunch button will take you to the registration page for any upcoming webinars. Our next Learning Lunch will air on February 5th and has the title Understanding SNOMED CT, the clinical terminology required for meaningful use. And we have some really excellent speakers on that topic, lots of experience in that area, so please join us for that event. Keep an eye on your email box and our homepage for other upcoming topics, and thank you again for joining us today at the ForMed Learning Lunch. Thanks, Christine.
Thank you, Wendy.